Hello, I'm Dr. Arifa Cassaboy, a practicing internist and a medical editor for Medscape and WebMD. Welcome to our weekly brief on recent medical news and findings. First, obtaining coronary artery calcium scores can prove valuable in determining which of your patients might benefit from statins and which won't. The German study included almost 4,000 individuals without known heart disease and who were not on lipid-lowering meds. Researchers calculated both their cardiac risk scores using current guidelines and their coronary calcium scores from cardiac CT. During the 10-year follow-up period, patients with baseline coronary calcium scores of 400 or higher had a cardiac event rate of 12.6%. But when baseline scores were in the less than 100 range, the chance of a cardiac event decreased to just over 3%. This means that you may be able to better risk stratify those patients who qualify for a statin per guidelines, but who have a low coronary calcium score, especially those with a 0 score. They may not need a statin after all. Next, there's evidence that women who use hormonal contraceptives, even low-dose formulations, face an increased risk of developing depression. Mood changes have long been associated with hormonal contraceptives. This new study looked at Danish data over a 14-year period. It included more than 1 million females between the ages of 15 and 34 who had no baseline psychiatric diagnosis. They looked at oral contraceptives, as well as the transdermal patch, vaginal ring, and hormonal IUD. Investigators found that women who used hormonal contraception were more likely to start using antidepressants or receive a diagnosis of depression. This supports the theory that progesterone is involved in the etiology of depression. Two key findings that I want to emphasize. Teenagers appear to be the most vulnerable, and depression symptoms were highest in the first 6 months of use and decreased thereafter. And finally, yoga may be just as good, if not better, than physical therapy for relief from back pain. The study included over 300 low-income patients experiencing chronic back pain with no obvious cause, like spinal stenosis. They were randomly assigned a PT, yoga, or education and followed for 1 year. The study found that for some patients, yoga was superior to PT in relieving back pain, especially among those who were more dedicated to practicing it. Another benefit was seen in pain medication use. At the beginning of the study, almost 75% of the participants were taking pain meds, with about 20% using opioids. After 12 weeks, 20% of both the yoga and the PT groups had reduced their usage of pain meds. There's good news from a cost perspective as well. Quality yoga instruction is often less expensive than physical therapy. And in general, we know yoga is good for the brain, and practicing it may help with pain tolerance. You'll find links to each of the stories we've included in today's news brief in the transcript listed below. From Medscape and WebMD, I'm Dr. Arifa Cassaboy.